I'm John Geaver from MedPage Today in Atlanta for the American College of Rheumatology annual meeting. The COX-2 inhibitor Vioxx was pulled from the market in 2004, but it may have had some unintended consequences. That's the conclusion of Dr. Bruce Kronstein of New York University.
What we found was that in the past 5 or 6 years, since about 2003, 2004, there's been a marked increase in the percentage of patients given narcotic analgesics for the treatment of chronic pain. And early on in the first 5 years of this study, up to about 2004, there was a relatively low but constant rate of falls or fractures of a little less than 1% of the population suffered a fall or a fracture. Starting in 2003, 2004, the percentage of patients taking narcotic analgesics or having a prescription for a narcotic analgesic started to increase. It was about it got up to about 15% or so in 2003, 2004. And after Vioxx and other COX-2 selective agents were taken off the market in 2004, we saw that there was a steady increase in the percentage of patients taking narcotic analgesics for their chronic pain, a fall in the percentage of patients taking standard non-steroidal anti-inflammatory drugs, and in association with that, there was about a threefold increase in fractures and falls overall in the entire group. And if you look in the groups who were taking narcotics, narcotic analgesics, they accounted for the entire increase in the percentage of patients who fell and fractured something.
The study covered about 10,000 patients older than 65 with osteoarthritis. Kronstein said the move to opioids may also have reflected a more general increase in the willingness to prescribe narcotics to patients with pain of all kinds.
I think there's been a general trend across the country in the past 10 or 15 years to promote the prescription of narcotic analgesics for the treatment of both acute and chronic pain. And the assumption is being that not so much that patients are less likely to become addicted now than they used to be. I don't think that many patients actually do become addicted, but the assertion that many, if not most of these patients, don't suffer that much in the way of any kind of CNS side effects that you might expect with opiates. So the thinking, I think, has been pushed to the point that people believe that you can give narcotic analgesics with less risk of people abusing them and less risk of them having trouble with CNS side effects. So I think the combination of that and the loss of some very commonly used, reasonably effective agents in 2004 led to this marked increase in narcotic analgesic use in this population.
With these findings in mind, Kronstein had a very simple message for clinicians.
We don't have great options, but trying to get people to use things other than narcotic analgesics, I think, is probably a better approach.
In Atlanta, I'm John Geaver, MedPage Today.